Hello beautiful people, welcome back to my channel. Thank you for the likes, the comments and the subscriptions. And if you're new and you haven't subscribed to my channel, please do, and don't forget to hit that notification bell so you get alerted each time I upload a new video. So today we're going to have a health talk. We're going to talk about anxiety and anxiety disorders. I'm hosting this as a health personnel. So today I'm going to talk about anxiety. What is anxiety? I mean, is it normal? Is it an illness? Is it a disorder? So anxiety is a normal emotion. It is your brain's way of reacting to stress and alerting you of potential danger ahead. So everyone feels anxious now and then. For example, you may worry when faced with a problem at work. You may worry before taking a test. You may worry before making an important decision. So occasional anxiety is okay, but anxiety disorders are different. They are a group of mental illnesses that cause constant and overwhelming anxiety and fear. So the excessive anxiety can make you avoid work, school, family get-togethers and other social situations that might trigger or worsen your symptoms. So with treatment, many people with anxiety disorders can manage their feelings. But if you don't know, or if you can't identify that you have an anxiety disorder, then it is very difficult for you. Actually, it will just keep on aggravating because you don't know you have one. There are types of anxiety disorders. There are several types, and these include generalized anxiety disorder. In this, you feel excessive, unrealistic worry and tension with little or no reason. And then, actually, with little or no reason. So, someone out of the blue starts getting worried. They have no reason for worrying. They get worried. They even fail to concentrate, Then there is what we call panic disorder. In this, you feel sudden intense fear that brings on a panic attack. So during a panic attack, you may break out in sweat, have a chest pain, or have a pounding heartbeat, what we call palpitations. Then sometimes you may even feel like you're choking or having a heart attack. Then there is what we call social anxiety disorder. This is also called social phobia. This is when you feel overwhelming worry and self-consciousness about every situation. About everyday social situations. So you may obsessively worry about others judging you, or being embarrassed, or being ridiculed, amongst others. Then there is what we call specific phobias. In this, you feel intense fear of a specific object or situation, such as heights or flying. So this fear actually is inappropriate. It is too much fear that it is inappropriate. Like you may even fail if, provided you have an interview, and it is on a tall building. Is it tall? Yeah, tall building. You may fail to go for that interview because you fear heights, or you may fail to go to town because you fear crossing the road. So this may cause you to avoid ordinary situations. Then there is what we call agoraphobia. In this, you have intense fear of being in a place where it seems hard to escape or get out in case of an emergency. So for example, you panic or feel anxious when on a plane or on public transport, or in a queue, a line. That is also an anxiety disorder. Then there is what we call separation anxiety. It's not only kids who feel scared and anxious when a loved one leaves. Anyone can get separation anxiety disorders. If you do, you feel very anxious and fearful when a person you are close to leaves your sight. You always worry that something bad may happen to your loved one. Then there is what we call selective mutism. This is a type of social anxiety where kids talk to their family. Like when they're in their family, they talk to the members in their family. But when they go out at school or church or in social places, they keep quiet. And you think they've never talked before. So that is what we call selective mutism. Then there is medication-induced anxiety disorder, just like you hear it. Medication-induced anxiety disorders. Use of certain medications or illegal drugs like marijuana and or withdrawal from certain drugs can trigger certain symptoms of anxiety disorders. So, there are symptoms of anxiety disorders. How do you know that you have an anxiety disorder? The main symptom is excessive fear and worry, and then anxiety disorder can also make it hard to breathe, sleep, stay still, concentrate, and then others are specific to a certain type of anxiety disorder. So common symptoms are panic, fear, and uneasiness. Then there are feelings of panic, doom, or danger. Then sleep problems, if you're getting sleep problems. Then there is not being able to stay calm and still, cold, sweaty, and tingling hands and feet, shortness of breath, breathing faster and more quickly than normal, which is called hyperventilation. And then there is also like you sometimes you get tense muscles, you may get a feeling of dizziness, you get worried about a situation or about a problem over and over again that you cannot stop worrying about it. Even when you try to get distracted, you fail. That is also a sign of an anxiety disorder. The other sign and symptom that I've not talked about is inability to concentrate, and then intensely or obsessively avoiding feared objects or places. So, anxiety disorders have causes and risk factors. Researchers don't know exactly what brings on anxiety disorders, but there is a complex mix of things that play a role in who does and doesn't get one. So, causes of anxiety disorders include genetics. Genetics. So anxiety disorders can run in families. Like if your relatives, your first degree relatives, your grandparents, your mom, your dad have had anxiety disorders or mental illnesses, then you're most likely to get an anxiety disorder. Then there is brain chemistry. Some research suggests anxiety disorders may be linked to fault circuits in the brain that control fear and emotions. Then environmental stress. Any stressful events that you have seen or lived through, life events often linked to anxiety disorders include child abuse, and neglect. If a person has incurred child abuse like defilement or rape, then they may get an anxiety disorder in the future. Then death of a relative or being attacked or seeing violence. All those are environmental stress factors and they can cause anxiety disorders. Then drug withdrawal or misuse. Certain drugs may be used to hide or decrease certain anxiety symptoms. Anxiety disorder often goes hand in hand with alcohol and substance use. Then medical conditions. Some diseases like heart disease, thyroid disease, lung disease can cause symptoms similar to anxiety disorders or make anxiety symptoms worse. It's important to get a full physical examinations with your doctor to rule out other medical conditions when talking to your doctor about anxiety. So, having talked about the causes, there are risk factors. Some things also make you more likely to develop an anxiety disorders. These called risk factors. Some risk factors can change and others, some you can change but others you can't change. What are these risk factors? One, history of mental health disorder. Having another mental health disorder like depression raises your risk of anxiety disorder. Then two, childhood sexual abuse. Emotional, physical, and sexual abuse or neglect during childhood is linked to anxiety disorders later in life. Then trauma. Living through a traumatic event increases the risk of post-traumatic stress disorder, which can cause panic attacks, by the way. Then negative life events. Stressful, like, how can I say? Stressful or negative life events like losing a parent in early childhood may increase your risk of anxiety disorder. Then substance abuse. The use of alcohol and legal drugs makes you more likely to get an anxiety disorder. Some people are also use these substances to hide or ease anxiety symptoms, by the way. But then they hurt them more. And then severe illness or chronic health conditions. Constant worry about your health or the health of a loved one or caring for someone who is sick can cause you to feel overwhelmed and anxious, which can later make you develop an anxiety disorder. Then being shy as a child. Oh my god, I almost failed to pronounce this. Feeling shy as a child. Shyness and withdrawal from familiar people and places during childhood is linked to social anxiety in teens and adults. Then low self-esteem. Negative perceptions about yourself may lead to social anxiety disorder. So, how is this diagnosed? How does a doctor diagnose that you have an anxiety disorder? If you have symptoms, your doctor will examine you and ask questions about your medical history. She may run a test to rule out other health conditions that might be causing your symptoms. No lab test can specifically diagnose anxiety disorders. If your doctor doesn't find out any physical reason for how you're feeling, then they may send you to a psychiatrist, psychologist, or another mental health specialist. Those doctors will ask you questions and use tools and testing to find out if you may have an anxiety disorder. So your doctors will consider how long you've had the symptoms and how intense they have been when diagnosing you. So it is important to let your doctor or counselor know if your anxiety makes it hard to enjoy or complete everyday tasks at home, work, or school. Are anxiety disorders manageable or treatable? The answer is yes. There are certain medications. There are actually two treatment types. One, medication your doctor will prescribe for you as a drug that is appropriate to your type of anxiety disorder, and it is your responsibility to sit down with your doctor and discuss about the cons and pros of these medications. So they include antidepressants, anticonvulsants, antipsychotics, among others. So the doctor will prescribe for you a medication that is appropriate for your type of anxiety disorder. Then there is what we call psychotherapy. This is a type of counseling that helps you learn how emotions affect your behaviors. So it's sometimes called talk therapy. And here a trained mental health specialist listens and talks to you about your thoughts and feelings and suggests ways to understand and manage them. And this will help you. Actually, the result we call CBT, it falls under psychotherapy. And if you are patient with anxiety disorder, your counselor can help you understand this. Then what else? Let's talk about managing anxiety disorder symptoms as you. There are tips that may help you to control or lessen your symptoms. One is learn about your disorder. The more you know, the better prepared you will be able to manage symptoms and roadblocks along the way. So don't be afraid to ask your doctor and any questions you might have. Remember, you are a key part of your healthcare team. Then stick to your treatment plan. Stopping your drugs suddenly can cause unpleasant side effects and can even trigger anxiety symptoms. Then cut down on foods and drinks that contain caffeine. These drinks include coffee, tea, energy drinks, soft drinks like cola, chocolate, among others. Caffeine is a mood-altering drug, and it may make your symptoms of anxiety disorder even worse. Then don't use alcohol and recreational street drugs. Substance abuse increases the risk of anxiety disorders, so avoid drugs, opium, marijuana, and the likes. Then eat right and exercise. Fast aerobic exercises like jogging and biking help release brain chemicals that cut stress and improve your mood. Then get better sleep. Sleep problems and anxiety disorders often go hand in hand. So make getting good rest a priority. Follow a relaxing bedtime routine. Talk to your doctor. If you still have trouble sleeping, then they will help you. Then learn to relax. Stress management is an important part of your anxiety disorder treatment plan. So things like medication or mindfulness can help you unwind after a stressful day and may make your treatment work better. So learn to relax your mind, relax your heart, relax your body too, by the way. The other thing is keep a journal. Writing down what you've gone through that day, important things in your life, what you've gone through. I mean, it will help you relax your mind and not keep on turning around in your bed while you're asleep. Then manage your negative thoughts. Thinking positive thoughts instead of worrisome ones can help you reduce anxiety. This can be challenging if you have certain types of anxiety. However, cognitive behavior therapy can teach you how to redirect your thoughts. And then get together with friends, whether it's in person, on the phone, or the computer. Social connections can help you like thrive and stay healthy. People who have a close group of friends that support and chat with them have lower levels of social anxiety. Then seek support. Some people find it helpful and uplifting to talk to others who are experiencing the same symptoms and emotions. Self-help or support groups let you share your concerns and achievements with others who are or who have been there, Then ask your doctor or pharmacist before taking like any over-the-counter medications or herbal remedies. Many have chemicals that can make anxiety symptoms even worse. So it can be a challenging and frustrating situation to live with anxiety disorder. The constant worry and fear can make you feel tired and scared. If you talk to a doctor about your symptoms, then you've taken the first step toward letting go of the worry. It can take some time to find the right treatment that works for you. If you have more than one anxiety disorder, you may need several kinds of treatment. For most people with anxiety disorders, a combination of medicine and counseling is best. So with proper care and treatment, you can learn how to manage your symptoms and thrive. So thank you guys for watching. I hope this health talk has been helpful, and if you found it helpful, please give it a like and comment down what you want me to talk about next time for the health talk. See you in my next video. Bye. Don't forget to subscribe if you're new. Love you. Stay well.